Many times an opioid overdose can mean certain death. But what if there were a way to completely reverse it? Find out how and who's trying to put these resources in your hands. The National Institute on Drug Abuse reports overdose deaths have increased dramatically in the past 10 years. Synthetic opioids such as fentanyl have been the largest driver of these deaths. In 2020, synthetic opioids comprised over half of all overdose deaths in the country. These synthetic drugs are dangerous and are becoming increasingly more prevalent.
Overdoses are the #1 cause of death for adult Americans under 45 today, and fentanyl is really a main contributor to that. 41,000 lives are lost in 2021 just to fentanyl, which is more than auto crashes, gun violence, cancer, and suicide.
Hayden Rudder is a junior at the University of Alabama. A year ago, he created UA End Overdose, a student-led organization that trains students in distributing Narcan, a drug which can completely reverse an opioid overdose.
40% of overdose deaths are actually when someone else was present, so if that person knew how to respond, they'd be able to save that life.
Rudder and his team train students on how to administer Narcan to an active overdose. They also educate about the scope of the fentanyl crisis and how they can help prevent an overdose with fentanyl testing strips.
Having these resources available and making them known that, you can call 911 and not be prosecuted civilly or criminally. Know that you're safe calling UAPD, as well as the steps to respond to an overdose. It's very important. This is an example of one of the kits that End Overdose distributes to each of its trained members. In it is contained 2 doses of naloxone, some quick reference materials, and a CPR face shield. End Overdose has trained over 1,500 students at the University of Alabama since 2022. Other organizations like Project Freedom are also making it a mission to increase the supply of Narcan in the greater Tuscaloosa community.
We train first responders, police, fire, EMS on how to administer naloxone and the dangers of opioids such as fentanyl and how to protect themselves.
Whitney Johnson is the outreach coordinator for Project Freedom. The Alabama-based initiative focuses on reducing opioid deaths through training and education. She believes that supplying first responders with Narcan is key.
We received a lot of feedback from our first responders, just letting them know that, hey, we've saved a life. We were able to recognize the opioid overdose. Also, the first responders can also educate the community in places that we can't. Although we do community education with Project Freedom, first responders are generally on the ground in the community and know those individuals. So when we educate them and make them aware, they can generally make the community aware as well.
With Narcan in the hands of more people, both first responders and students, these organizations are hoping their joint battle can increase the chances of saving more lives in the fight against opioid overdoses. In Tuscaloosa, I'm Ben Smith reporting.